I think one of the most important things that has struck me throughout these sessions that I've managed to attend is that I think when it comes to providing healthcare, I think the primary person who's going to make the decision is actually the patient. Gone are the days when you say and they say, yes, doctor. Now it is like they say and you say, yes, patient. I think that's the paradigm shift. That, in fact, most of the talks, if you look at it, they are already saying that patient autonomy is most important. And even if the patient decides that I know this is the best possible treatment, but I choose for something that is maybe less proven, but that is the choice that they have made, then we have to respect that and do what is best within our professional capacity to provide that level of care. I think patient autonomy has come out very strongly in most of the messages that we have heard today. And I think that is something that most of us will need to accept and respect.
Great. Are you going to make any moves towards making that more a part of healthcare?
I think, well, at least for ONG, I can tell you that we have started that in a certain way, whereby if now a patient says, no, I do not want a cesarean section, then we are not going to say, look here, the baby is going to die. And no, we will tell them all the pros and cons, and if that's your call, then we respect that call and we do it. But of course, it's not easy. It's not easy to come to terms with this conflict when, especially like some of us who have been on the other side of the wall, so to speak, where we have dictated terms, and now suddenly you come and there is more of interaction. We are making that shift. We are making that shift.
Great.
Yeah.
What about you?
Well, I think the other end of from the patient perspective is the teamwork of the health providers. I think the teamwork that we talk about in the past, in the Asian context, is always paternalistic. It's always a top-down kind of direction. But I think in this modern age of social media, and people had a lot of access to information, I think the hierarchy should be a bit more flatter now. So one of the things that we learn about is how high energy teams function, particularly in the context of harnessing the energy as well as the input from every member from the team. Particularly in the healthcare services, you really got to go down to the frontliners, where they are the one who serve the public or the patients, and they are the one who actually have a lot of ideas to make a change for quality and safety.